Hello students, so myself are Ranjitha, Assistant Professor, Department of Biochemistry, School of Adult Health Sciences, Salem, VMS Hospital Campus, VMRF-DU. So today topic is a collection of specimen. So collection of specimen we have to collecting the lot of samples in our body. So first one is the blood. So around the 25 to 30 ml of blood is the collected and preserved. The preserved means the collecting the blood will be the preserved in the separate area. It should be collected in the bottle. The preferably from the peripheral site of portions will be we have to the collecting from our bottle, such as vessels of the neck and arm or leg. Blood should never be taken from cavities after evisceration, as it will be contaminated from other body fluids too. So it is also preferable not to collect blood from the heart except in CO poisoning. This is the first condition of the collecting from in our heart areas. Then the second one is the urine. Urine is obtained by the catheter of the suprapubic puncture before autopsy or by puncture of the bladder after eviscerations. So evisceration means the other body fluids will be contaminated with these samples. So that is called as the eviscerations. Then the second point of the urine sample collecting in the around the 100 to 200 ml is the collected. If less than, collect the whole quantity. Then third one is the CSF. The CSF means the cerebrospinal fluid. So only the expert and fully practitioner only the collecting from the type of fluid is generally not required for the toxicological purposes. If required, it is obtained by cisternal or lumbar puncture, the puncture of the lateral ventricles or aspiration from the base of the brain after reflecting the frontal lobes. The collecting as much fluid as the possible. If a drug is injected intravenously after death, it will not cross blood-brain barrier. Then the fourth one is the bile. It is directly collected from the gallbladder. So gallbladder, the one of the major organ of our body, is only the bile fluid only the collecting from in our gallbladder organ, as it is the too thick to be aspirated by a syringe. It is helpful in the morphine and chloromazine poisoning peoples, especially these type of fluids only collected from in the poisonous cases especially. Then is vitreous, a fine hypodermic needle attached to the 5 ml syringe is inserted into the outer canthus of the globe after pulling the eyelids aside. The vitreous means the collecting from the sample in our eye is using this one of the needles. Needle will be the using to in our eye areas. Then is collecting the smoothly handled with the sample of the vitreous portions. Then needle is inserted in the center of the globe and as much vitreous is aspirated from in both eyes. The water is injected with the same syringe to restore the shape of the eyeball. Then the sixth one of the sample is the stomach contents are collected directly into the wide mouthed bottle. The exterior of the stomach is washed and the greater curvature is opened with the large scissors. Then the interior is exposed to see any capsules, tablets, etc. and preserved the separate places. Then the seventh one of sample is the bone and bone marrow. So about 200 grams of bone should be collected. It is convenient to remove about the 10 to 15 centimeters of the shaft of the femur. Bone marrow is obtained from the sternum, femur and vertebrae. Then is the eighth one is the hairs. An adequate sample of around the 10 grams of head and pubic hairs should be removed by the plucking out the complete with roots and not by cutting and preserved in separate containers. Hairs will be the only we have to the collecting from in complete shaving in the between in our scalp areas to don't cut and anything in the samples damage within the accuracy and error of the samples of in the hair collecting processes, because of once that will be the damage we would not identify the proper result of this content. Then is the ninth one is the nails and skin. All the nails should be the removed entire from their bed and the collected in the separate envelopes. A skin piece of at least the 2.5 cm square from the affected area in case of corrosive poisoning and from the thigh or back in case of the suspected heavy metal arsenic poisoning is taken. Firearm injury cases, a skin portion of the suitable size around the entrance and exit wounds should be exercised. So this type of samples will be we have to collecting from only the severe injured sections and all the time the severe accident and any of the fire injuries at the time only we have to the collecting from this type of samples, right. Is the last and least one of the samples will be we have to call as the nails and skins. Then the continue topic of the preservation of the viscera and blood samples and all the samples and how to preserve. Ideally there should be no delay between the collection of specimen and the analysis in the laboratory. If the delay is short, refrigerator storage may be sufficient to preserve the samples, but the transportations of the viscera to the forensic science laboratory and their examinations at the end would naturally take some time to product from vitrification to set in and render chemical analysis difficult. The certain preservatives should be used. So one of the important point for the transportations of the samples, we have to using some uncontaminated chemicals agents will be using to collecting tube. Then only you have to transport by the one area to another area, because of that samples will be definitely contaminated in any other atmospheric pressure environmental. So only we have to the collecting the samples will be in the proper repeated tubes only. Then will be the examine the samples, then we have to the clear and accuracy results for the after that time. So the preservation is very important point for the collecting of the specimen procedures. Then is the preservation for the blood. The best preservative for the blood samples is the sodium potassium fluoride at the concentration of 10 mg per ml, which preserves the blood for the more than 3 months at room temperatures. This is a preservation of the blood only. Then is a 0.5 mg sodium citrate plus 0.1 mg of the mercury chloride is another suitable preservative forms. A suspected poisoning case, the excluding oxalic acid 10 ml of blood is the mixed with the 30 mg of the potassium oxalate. This is anticoagulant agents and 10 mg of the sodium fluoride and this enzyme inhibitors for oxalic acid and ethylene glycol. 30 mg of the sodium citrate should be used in the instead of the other anticoagulant agents too. These are they using for the preservation of the blood samples. These samples will be using for the untoxic effects and not contaminated for the long term of the blood samples in refrigerated in various areas. This type of the anticoagulants and preservative agents will be using for the preserve the blood samples. Heparin and EDTA should not be used as an anticoagulant since they interfere with the reduction of certain poisons and methanols. So the heparin and EDTA is only using in the blood clotting procedures, especially you have to using the laboratory uses. Once in diagnostic laboratory, they are using this type of anticoagulants. Easily we have to the collecting from the serum samples, then using the all biochemical testers. Because of using this type of anticoagulants, we have to preserve the refrigerated only. So at that time, so heparin and EDTA they interfere with the poisoning effect will be present in the preservative duration of timing. So don't use in the heparin and EDTA should not in anticoagulant agent of the preservative procedures. In case of the carbon monoxide poisoning, a layer to the 1 to 2 cm of the liquid paraffin should be added immediately over the collected blood sample to avoid exposure to atmospheric oxygens. So only we have to the collecting from the carbon monoxide poisoning patients. At the time we have to using the blood sample. So using this type of anticoagulants will be the preferable for the avoiding the other atmospheric type of conditions. So other preservatives for the using in the other samples in that, in all cases of the poisoning including of the carbolic acid and but exclusively of the other acids, the rectified the spirit is used to preserve the viscera as well as in urine. Alternatively, we have to saturated solution of the common salt should be used to preserve viscera other than blood. In all cases of the poisoning inclusive of the carbolic acid but exclusive of the other acids too, the 10% of formalin is used as the preservative for tissues. I mean for the histopathological examinations. Yes, the well known all I think is a formalin used for the long term of the unpathological conditions of the examine for the tissues. Example, pathology lab, museum, etc. preserve the lot of organs. That organs only they are dipped into the formalin solutions only. They are using the glass jar bottles. That formalins will be the product the organs, and also long term of the uncontaminated for the don't any interfere within the organs. This is the best sources for the pathology unpathological condition of the organs. You have to only the using the formalin solutions in the especially the 10% of concentration the formalin is the used for the preserve the whatever that the any of the tissues we have to preserve in these type of solution using to preserve the long term of time durations. Some method of preservations. The stomach and small intestine and their contents should be preserved in one wide mouthed glass bottles. Only they are using the one wide mouthed glass bottles. It's a large size of glass bottles. It's like the big jar of glass bottles only you have to using in the this type of organs, stomach and the small intestine. Using the formalin liquid you have to store in the this type of jars, the mouthed glass bottle jars. Then pieces of liver, spleen, kidney should be placed in the another bottle, and urine is the third bottles. When additional material is required to be sent, it should be dispatched in that separate bottles. Blood should be the sent in one vials only. Using the use and throw vials only we have to preserve the blood samples, but is organs will be only stored in the glass bottles only. The wide mouthed glass bottles will be they are using for the all tissues like large or small tissues, whatever that we have to only store in the large glass bottles. The solid organs are cut into the small pieces to ensure the penetration of the preservative. In case you have the large sizes of the organs, the pathological organs, you have to cut into the small pieces, then you have to store in the large mouthed glass bottles using the formal solutions, the preservative the separate area. The bottle should not be completely filled with preservative. However, it is necessary that complete immersion of the viscera is done. In the material is not completely submerged in the solution, decompositions will take place with the result that gases may form and either undo the rip, filling the contents or even break the bottle. So whatever the organs we have to using the bottles like large mouth or small mouth is whatever that, but only conditional basis we have to follow by the filled in the preservative solutions. This is an important point. The stoppers of the bottle should be well fitted, covered with the piece of the cloth and tied or stirring at the ends and sealed using the departmental seal will be the important for the each and every preservative bottles. Then each bottle should be labeled properly, containing autopsy number, the name of deceased, the name of the organ, then date and time and place of the autopsy, followed by the signature of doctors. The sealed bottles are then put in a viscera box which is locked and the locus sealed. The key of the box and the specimen of the seal is put in the separate envelope and it is also sealed. Dispatch of the viscera means the sealed box and the envelope containing the key is then handed over to the police constable in the return of a receipt. Is everything you have to followed by the preservation of the materials and organs is protocol for we have to followed by in our government. Then he delivers in the personally to the office of the provisional chemical examiner after obtaining a receipt of the same. Thank you for watching this video.